Assalamu alaikum, the communication day. First scenario, the patient name Mr. Adam. He's 60 years old. Man, your, your role, you are the senior house officer in the endocrinology clinic. Mr. Adam was referred to your clinic a week ago by his GP with uncontrolled resistant hypertension. He's currently using valsartan 160, amlodipine 20 milligram or 10 milligram, and thiazide. Yet his office blood pressure around 170 over 105 on multiple visits. He is also using fluoxetine once daily and diazepam PRN, which was prescribed 3 months ago when his GP referred him with panic episodes to the psychiatrist. His workup in your clinic confirmed the presence of pheochromocytoma with elevated urine and plasma metanephrines. CT showed unilateral left adrenal tumor. MIBG test scan showed no extrarenal uptake. The team is planning him for laparoscopic adrenalectomy after controlling his blood pressure with phenoxybenzamine and propranolol for 1 week. Your task is to explain this situation and update Mr. Adam about his case and answer any concern he might have. So we can start, Dr. Sosa.
Okay. Hello.
Yes.
Yeah. Hello, my name is Esusa. I'm one of the doctors in the clinic today. Can I confirm your name and age, please?
My name is Adam, doctor.
And you are how old?
Dr. Marwa, can you check your connection, please?
Hello?
I'm 60, doctor.
Okay. Pleased to meet you. I've been asked to speak with you today concerning your condition. But just to make sure we're on the same page, can you just tell me what you know about your condition so far?
Doctor, I'm suffering from hypertension. I take many medication, but not without benefit. My blood pressure is still high. Also, I have like panic attack. They give me 2 medications, but nothing help.
Oh, I see. That sounds very frustrating. I can only imagine what you are going through. I see that you've done some tests. Has
Yes.
anyone told you the report of these tests?
What, doctor?
Has anyone told you the results of the tests?
No one, doctor. I'm coming to know what happens.
Okay, that's fine. I'm going to tell you the results today. But before I do you have any idea why you think your blood pressure is up and why you've been having these panic attacks?
Actually, no, doctor. I don't have any idea about this.
Okay. So the results of the test you did, which included a urine test and scans, shows that, unfortunately, I'm afraid to say, you have a condition called pheochromocytoma.
What's this, doctor?
Okay. So this is a growth in one of your glands that produces adrenaline. Adrenaline is a hormone that causes your heart rate to go up. Usually in cases when you are scared, it can cause your heart rate to go up, it can cause your blood pressure to go up, and it can cause you to have panic attack. So that growth makes this adrenaline produces a lot of this adrenaline in your body, which is why you are having these symptoms. Are you following me, Mr. Adam?
Yes, doctor. You said growth. That mean cancer?
So it is not cancer per se, but it is a growth, more like a tumor. We need to do some more tests, and we need to do something else to really understand what this is. But from most of the tests we've done, we think it's likely not cancer, but just a growth causing this adrenaline in your body.
So how can we know is it cancer or not cancer?
Okay, so at the moment, we have discussed with my consultant, and one of the things we're going to do, if you agree, is to do a surgery where we take out the growth.
How you will take out?
Where we take out the growth.
You will open my tummy?
So what we propose to do is more like a keyhole surgery, where we put some little cuts done surgically, and put a camera through so we can see the growth, and then take it out through that small hole that we will make in your tummy.
Okay.
So before we do that though, because your blood pressure, you mentioned correctly that your blood pressure is on the high side, we are going to give you medications different from the one you are taking at the moment. These medications, there are two medications called phenoxybenzamine and propranolol. And what they're going to do is help you bring down the blood pressure before we do the surgery. Are you following me?
Yes, doctor. But can I continue with this medication and don't do this surgery?
Come again?
Can I continue on this medication you said and not go to do this surgery?
So these medications, all they do is just take care of the symptoms of the high blood pressure. If you do not do the surgery, we are not actively treating the cause. And just giving you these medications will just be bringing down the symptoms, which will not be very beneficial for you in the long run.
Okay.
Yes.
So, doctor,
Yes.
after doing this operation,
Yeah.
will I continue taking medication or will I stop?
So these medications we're going to give you 1 week before this. So you're going to take them for a week. Once we have taken out the growth, we will then assess you again. So you will be on our follow-up to see how much progress you have made.
Okay, doctor.
So talking about the keyhole surgery we're going to do, I would like you to know that I would just like to talk you through the procedure if you are happy with that. If I can, do you agree for me to just tell you a little bit about the procedure?
Yes, please, doctor. I want to do this surgery.
Okay, so prior to this procedure, you'll be admitted in the hospital more for like a workup to make sure that you are ready for the surgery. The anesthetist, that's the one who's going to put you to sleep, is going to have a word with you and make sure that you don't have any allergies or things that may stop you from going through with the surgery. And then you'll be put to sleep, and we will do this keyhole surgery. And afterwards, we are going to monitor you. Now, one complications that may occur could be infection. There could be some bleeding, and there could be pain. Now, how we're going to manage this is the infection. We're going to make sure that when the surgery is done, that all of us will practice what we call aseptic technique, meaning that we'll make sure that everything is sanitized so that there's no risk of an infection. In terms of bleeding, we're going to do some blood works and make sure you don't have problems with bleeding. And then for pain, we will give you painkillers as well. Are you following me?
Yes, I'm not you, doctor.
Do you agree to having this surgery?
Yes, doctor. If this surgery is only solution, I'm going to do it.
Okay. Do you have any further concerns?
Yes, doctor. Is this condition can transmit it to my kids? Is it inherited condition or it is runs in families?
Well, your concerns are highly valid. Now, this particular condition called pheochromocytoma can occur alone. Sometimes it can occur as a group of disorders. for which can be inherited by family. At the moment, we still need to do some investigations. We are not quite sure whether this is the type you have, whether this is just the pheochromocytoma alone, or whether there are other glands that are affected that can be inherited. These tests will be run as well. And then we can make another meeting and and answer this question.
Yeah, doctor.
One
Thank
Okay.
you.
minute left.
Okay. Before this, can I just know, are you dependent on anyone?
Um, yes, my kids, I have 2 sons.
Okay. And what do you do for a living?
Now I am retired, but before I was engineer.
Okay. Okay. Do you smoke
No, doctor.
or take alcohol?
Occasionally only.
Okay. And do you have any allergies we should be aware of?
No.
Okay. Thank you for having this discussion with me today. I am going to give you some leaflets concerning the condition pheochromocytoma and the surgery. And if you have any more questions, you can call us and uh, we'll answer your questions.
Thank you, doctor, very much.
Okay. And just in case, if it looks like your blood pressure is getting too high again, or you are having these panic attacks, or you're having chest pain, you can always come back to the hospital. Okay.
Okay, doctor.
All right then. Thank you.
Okay, perfect. Amazing, really, mashallah.
Yes.
Okay, 10 minutes already passed. Time is up. Dr. Marwa, can you comment first?
Yes, she did it very well, very organized. She explained everything, the disease procedure. But the only thing she missed, I think, the consent. She didn't talk about the consent,
Yeah, although she asked
right?
verbally, are you agreed for the surgery? But yes,
Mm,
it's necessary to give you the
correct.
consent form to sign it. Yes, I agree for this
Oh,
comment.
okay. Okay. I didn't know. I thought the verbal consent was enough. Okay. Thank you.
Yeah, the verbal consent whenever you are giving medication, admitting the patient, but for the procedure, surgery, should be as written consent. Is it clear?
Yes. Thank you.
Okay, any other comment, Dr.
Also,
Marwa? Yeah,
no, she did everything.
yeah, I agree with this. I think she did it in the ideal way. She was perfect in everything from the introduction, the explanation of the disease, the warning shot. I agreed to do it like breaking bad news because it's having 10% risk to be a cancer. But the question for is it a cancer? Also, she answered well. We still need to go to do more investigation, workup to confirm is it a cancer or no. Because 10% of pheochromocytoma might turn into a cancer, although it's not confirmed as a cancer yet. I think she answered this question also properly. The procedure also, she explained it briefly how it would be done after preparing the patient before and during and after the possible complication, how they will go through by camera, which is laparoscopy. I think she meant like laparoscopic, and it will be monitored or the patient will be monitored after that. Then the medication she should take and the answer for the concern, is it possible to continue on this medication forever and instead having a surgery? Yes, it's a matter of preparing only to the surgery. This medication given only before the surgery, and it's not the management or the treatment for your condition. And you can add, we should have analysis for or from the gland itself or the growth, as Dr. Isos said, just to analyze it. Is it possible to be a cancer or no? The question about the genetic inheritance or running in family, again, there is 10%. You can remember, Dr. Isos said the rule of 10 about pheochromocytoma. You can remember this. So it's 10% familiar, 10% as a cancer, 10% bilaterally.
Yes.
Yeah, it was rule of 10. So you can remember this number in any question related to the pheochromocytoma. Then at the end, yeah, are you agreed for the surgery? She might say, yes, doctor, I feel okay about the surgery. But even you have to hand her the consent form to read it, and to sign at the end if she's agreed for the surgery. And if she's changed her mind, it's okay. She can change her mind any time. And at the end, the social support. But the question you ask, who's dependent on you, or you ask, you are dependent on whom? So the question would be, who's dependent on you?
I was
I guess.
Yes, I wanted to ask both. I wanted to first say who are you dependent
Yeah.
on, and then who is dependent on you, because I don't know if this patient has carers, and I don't know if he's caring for anybody. But when I asked the question, I think she misunderstood it as who is dependent on you, which is why I just continued in that line.
Yeah. Okay. Because this is our usual question: who's dependent on you? Why? Because you are offering support for those who's dependent on this patient. This patient, there is some people who's dependent on him. He's working. If you admit this patient, the support he's providing to his family might be cut. So the best question is, who's dependent on you, not you are dependent on whom, right?
Okay.
Yeah, so it's who's dependent on you, then offer support for them if they need. If he needs sick leave, you can provide him sick leave. If he needs some other support, you can support him with this type of the support he needs. Then the smoking, alcohol, the job. And if he told you I'm retired, you can ask about his daily activity, how he's coping with his daily activity. You are now taking care of this patient while he's at home, if he's okay doing the daily activity at home since he's retired, right? So you can ask, is that impacting on your daily activity at home? And at the end, yes, you can give him leaflet, brochures, websites, the contact number. If in case of any emergency, don't hesitate to call us. Really, you can get at least 18 out of 20 in this scenario. Or it was, 16 marks. Yeah, 60 marks. So you can get 15, maybe not less than 14. Perfect. Really, it was amazing and fluent and conversative. Why? Uh, yeah, I mean, conversation was okay. You give her chance always to express, to ask you, to interact with you. You let her talk. You kept asking for the following understanding. This is the best way how to do the communication. Perfect, Dr. Isosa. As a first time of practice, always I'm commenting and embarrassing, impressive when the first performance like this, because you first practice with me, right?
First practice, but I've been listening to YouTube, your posts on YouTube, and I've just been a listener in this meeting. So it's more thanks to all of you that have been listening to.
Thank you so much. I felt like you are following always my approach. That's why you did it perfectly. Thank you, Dr. Isusa. And we will open the discussion now. Anyone has any question, suggestion, concern?
Yes, Doctor.
Yeah.
Salam alaikum.
Walaikum
Um,
assalam.
I found in some books when they speak about in cases of chromocytoma, they said that they do not explain the laparoscopy procedure because it is not written in the scenario. They just say the surgeon doctor will tell you the details. Is it right, or I understand
Yeah,
it?
it doesn't matter if you explain it, and Dr. Isosa didn't explain it in details. She just mentioned that there is a whole surgery or a whole cut or small cut. Through this cut, maybe they will pass a camera, and through this camera they can take this growth out. I guess you need to do, because this scenario written there, adrenalectomy will be done. So it's one of the tasks in this scenario, plus the pharmacological option before the
Laparoscopic.
surgery.
It is mentioned in this scenario.
Yes, it's
Laparoscopic
mentioned.
adrenalectomy.
Yes, yeah. So
Yeah,
it's
the
mentioned.
laparoscopist mentioned that in the task he said yeah, I say the update, but he don't say to explain the procedure. I'm just learning really. I'm just asking a
No, no. In
question
this
to learn.
scenario, maybe Dr. Iman, you are talking about other scenario, but in this scenario, it was written that there is a possibility of surgery, adrenalectomy.
Yes.
Yeah, you can read the
Okay.
scenario back. Maybe the scenario you are talking about, it wasn't there, just preparing the patient for the surgery, and they give him pharmacological option. But in this scenario, it was written. So it depends in every scenario. That's why I'm always saying, it's a general advice. Read the scenario once and twice and thrice. Why? Because you might miss one sentence and you will be confused inside by the surrogate words. He might tell you something you didn't read carefully, but if you read the scenario outside carefully, you will be ready how to answer every concern. And intentionally, they are writing some sentences to know if you are focusing on the sentence in the paragraph. So read it once and twice and twice and thrice. Write down in your paper what they give you as a data, and address every concern according to the data in the scenario.
Okay. Thank you.
Most welcome, Dr. Iman. Thank you for your question. Yeah, any other
Yes,
question?
yes, good evening.
Yeah, good evening.
Yes, a very interesting scenario. I think included in the scenario, because this patient is preparing for surgery and he
Yeah.
is diagnosed as pheochromocytoma,
Mm.
we should explain in detail the preparation for surgery in this
Yeah.
patient, especially to avoid the storm, to avoid the
Yes.
crisis of pheochromocytoma. You have to tell
Perfect.
him before taking anesthesia or taking the sedation of the operation, you have to be taking the certain kind of medicine for controlling the hypertension. And this medicine is very important to save your life.
Yes, I agree. Yes, you should do that. Sorry, we cannot hear you, doctor. You can hear me. Is there connection from your side or my side? Hello? Hello?
Dr. Basim, I just would like to ask you something.
Oh,
In
Dr. Iman, sorry, you can hear me now.
yes,
Okay, the doctor was talking. I think he was talking, or there is interruption from my side or from his side.
no, he said he
He,
confirmed that
he,
I had to
he,
explain the surgery.
yeah, yeah, okay, but he finished his talk because I kept asking. I cannot hear him. He finished his
No,
talk.
I yes, he finished his talk and he don't
Okay. 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 Anyway, I would like to thank him because yeah, he confirmed what we are saying, and yes, we should do the preparation as a pharmacological option, then the surgery as we mentioned always, pre or before, during and after. Briefly, don't speak a lot, don't spend a lot of time because you have another task explanation of the disease. Yeah, now your question, Dr. Iman.
Yes, I was just confused because in a Roch book, he presented also a case of pheochromocytoma, but he said that the blood investigation, including urinary and plasma metanephrine and CT abdomen, confirmed the diagnosis of pheochromocytoma. And you are an SHO in the outpatient clinic, you have been asked to discuss the results. So here, because in this scenario in a Roch clinic, in a Roch book, he didn't mention laparoscope, so I'm not supposed
Yeah.
to say the details of laparoscope. Is it right? I get
Yes.
it right?
Yeah.
Okay.
Yeah. Exactly.
Thank you.
That's why
Thank you.
I said every scenario will be separate. So
Yes.
read every scenario. By the way, Dr. Iman, nowadays in every diet, they might repeat the scenario, okay? The idea, the main concept of the scenario, but they change some sentences or some words just to distract you or to make you confused. For example,
Yes.
the paracetamol overdose. Sometimes they bring it as by mistake. Sometimes they bring it like intentionally. So if you are not sure about these sentence, you might be confused saying another word or even pretending this medication was given by mistake or was given intentionally or he took it as suicidal. So it would be different totally in the task. So again, read carefully the scenario. The idea may be there. I mean, the concept may be the same, but different task. Okay, as pheochromocytoma, sometimes they will bring it like as you said in the roh without the surgery. In another scenarios, they bring it as a pharmacological only explanation. By the way, there is scenario as pheochromocytoma with blood pressure, high blood pressure, I mean hypertension, and the scenario was misdiagnosis or delay diagnosis. And the same idea, patient was hypertensive for a long time, he took a lot of medication, but still is not controlled yet. And when they do some further workup, they found positive metanephrine in the urine or blood. So he was mismanaged by the GP. Now you are talking about delay of management, particularly, for example, if more than 6 months patient is suffering from headache and he went once and twice and thrice to the GP, he didn't refer him to the hospital or the endocrinologist. That's why he was misdiagnosed and of course he's mismanaged. This is a mistake. So the same idea, the same data of scenario, pheochromocytoma and high blood pressure, but in this scenario they explain how to manage. In another scenario, they put it as misdiagnosis or delay diagnosis. So please don't get inside the station unless you are sure what is the task and every sentence you are read carefully.
Thank you. Thank you for you and all the
All right.
colleagues. Thank you.
Yeah, most welcome, Dr. Iman. Okay. Let's go to the next scenario. I send it here. No, wait, not yet. Dr. Marwa, you can see it. No, actually,
No.
yeah, yeah, I'm so sorry. She shared to me, but I didn't share it here. Yes, I can. Yes, you can see it now in the chat box. The scenario is Mr. Donald Murphy, 74-year-old. You are about to see Mr. Murphy in the clinic. He had a right apical bronchial carcinoma, Pancost tumor, diagnosed 8 months ago. He had radiotherapy for a bony metastasis in the right clavicle. His pain, however, has been worse over the last 4 weeks, and he was started on morphine sulfate tablets and is presently on 30 milligram BID. In addition to the Voltaren, Voltarol, he was already taking. I think Voltarol is non-steroidal. Anyway, however, the hospital nurse specialist tells you before the consultation that she believes he is refusing to take analgesia and as a result, he is suffering greatly from the pain. Mr. Murphy is fully aware that he has terminal illness. Okay, so the task is to speak with Mr. Murphy, Donald Murphy, and address his concern. He is cancer, Pancost tumor with terminal condition, metastasis in the bone. He's suffering from pain. He's not receiving his medication, refusing to take the medication. I will give you 2 minutes, Dr. Marwa.
Yes.
We can read the comment. I think no comments. Only asking about the scenario. Okay. Any suggestion for the previous scenario? Any comment? Anyone want to add suggestion?
Dr. Basim, I had a question.
Yes.
If a patient in social life say that he is not dependent on anybody, will I also offer social care, or I had to offer social care if he will be dependent? You understand? If the patient says that he is independent and it will not affect the disease will not affect his independency, will I also offer social care work?
No need, no need. He said to you, I'm independent. I don't need any support. I am fine. No need. But you can ask about his loved person who's dependent on him, not only him. In this
Yes.
age, the patient will not be dependent on himself, or he will not be only supporting himself. He's supporting the family. 60 means he has kids, he has wife. So you have to ask about who's dependent on him, not only him. Plus the daily activity. Some patients will tell you, yeah, I'm fine, I'm retired, I'm staying at home. Would you offer him some support at home if he's feeling difficulty to cope with his daily activity? It's important to ask about this. He might tell you, yeah, doctor, I feel difficulty, or I face difficulty at home while doing my daily activity. So you can support with this, especially if he's living alone. So it
Okay.
depends on the scenario. What he will tell you, you can answer his concern. But you have to ask
So
this question: who's living with you? Who's dependent on you? What's your job? Okay.
okay.
Who's living with you? He will tell you, for example, my wife, my kids, my son, my daughter, my brother, whosoever. Then you can ask, who's dependent on you? Maybe he'll tell you, I'm living alone. But who's dependent? Maybe he'll tell you some of his family members. Then what's your job and the impact of this on your job? No, I'm retired, so is that affecting your daily activity? These are the questions for the social support, plus smoking and alcohol.
Okay. Thank you.
Yes, well. Okay, any other question? Any comments? When you're ready, Dr. Marwa, let's start.
Yes, yes, we can
Yeah,
start.
perfect. Yeah, here you go.
Hello, good morning.
Good morning.
Can I my name is Dr. Marwa, and the doctors in the clinic today. Can I confirm you are Mr. Donald Murphy and you are 74 years old?
I am.
Mr. Donald, we are here to discussing your medical condition and answering your concern. Is that okay with you?
Yes.
Okay. Before starting, can you tell me what you know about your medical condition?
Well, I was diagnosed with lung cancer 8 months ago. And at the time, apparently it had spread to my collarbone, and I was given some therapy for that. But in the last 4 weeks, I've been having pain in that collarbone, and it keeps me awake at night. So the GP and the cancer team, they've given me some morphine tablets in addition to the Voltarol I'm already taking, and they've slowly increased it. But to tell you the truth, doc, I haven't taken the medications in about a week now.
I'm sorry for what happened to you and your suffering, Mr. Donald, and we are here to help you and give you our best care. But can you tell me why you stopped taking medication?
Doc, it's morphine. Usually, I don't like taking tablets anyway, but I'm afraid I could get addicted to morphine. So I rather just bear the pain than become an addict.
I highly appreciate your concern about this, but Mr. Donald, in your condition, uh, the pain is severe, and we need to control this pain by uh, giving you this morphine, because the regular painkiller um, don't help much in relieving this pain.
I
So that
I understand that, but I don't want to be an addict.
I appreciate your point, but not everyone take morphine will be addicted on it because we give you this morphine by the minimal effective dose and we titrate it or increase it gradually to reach the minimal effective dose to keep you pain free or as much as we can because the only effective painkiller in this situation is morphine.
Okay. Oh, okay. I get that. But then when I was taking the morphine, I was constipated. I didn't really like that a lot.
Yes, you are right. One of the complications of morphine is constipation, but we can deal with this by giving you some medication to relieve the constipation. Uh, how does it sound for you?
Well, I can give it a try, but Doc, the main reason I don't want to take the morphine is because it makes me drowsy, and I'm afraid that I may die in my sleep.
We also we can deal with this drowsiness by modifying the dose. Uh, we can decrease the dose or decrease the dose and watching your pain and follow your pain. If decreasing the dose not affecting the pain or not make it increase, we can decrease it in the dose that can keep you not drowsy and not sleep more.
Okay. Okay.
Uh, do you have any other concern about morphine?
No, I think those were just the biggies. But if you assure me that I won't die in my sleep, I'll give it a go.
Oh, we will we need to reintroduce this medication to because I expect that the pain you have is severe and you can you cope with the pain in your daily life?
Well, it wakes me up from sleep, and the pain is just constantly there. So yeah, I don't really do much of my daily activities. I just lie down and just try to bear the pain since I'm not taking the morphine.
Yes, Mr. Donald, exactly. Our concern now is to keep you pain-free and because your condition is advanced and I'm sorry to tell you that, but our concern now is to keep you pain-free as much as we can.
Okay.
And the morphine is the best medication in this condition.
Okay, doctor.
Okay. As you mentioned, Mr. Donald, you have this nasty growth in your lung and the spread in bone.
Yeah.
And you take now this morphine for pain. Do you have any expectation about uh, the management plan or what will be the situation in the future?
Well, I expect not to get addicted to morphine, and I expect not to die in my sleep from morphine. That's my expectation.
So we will manage this concern and we will follow the dose and adjust the dose in order to keep it a minimal effective dose without possible side effect. But do you have any, do you mention any wishes or anything you want to be done in case that you have decrease in your conscious level or your case deteriorated? I'm sorry to mention that.
Yeah, no, I haven't thought that far about it.
I recommend for you that it is maybe it's a good time to mention your wishes.
Maybe I'll think about it, doc, and probably get back to you about that. I've really not had time to think about it.
Okay. Also, do you enumerate anyone to take decision in case you can't make a decision to any reason during the course of your illness?
Well, I have no family, so there's really no one for me.
I'm sorry for that, Mr. Donald. Do
Yeah.
you need any kind of support regarding financial support or social? Even?
Not at the moment. I'm good. When the pain is better, hopefully I'll be able to do my daily activities. So at the moment, I don't need help.
We are here and all time ready to support you if you need any help regarding the pain or regarding uh, uh, any mood change or anything. I will give you the contact number. You can contact us anytime. And if you have any side effect like drowsiness or constipation, you can contact us also.
Okay. Thank you, Doc.
1 minute.
Welcome.
1 minute left.
Also, Mr. Donald, I may give you some websites and some groups in the internet to join it. They may, you may share your experience and they share experience with you in order to uh, relieve uh, uh, relieve any stress if you have, or get more information about your condition and sharing experience with each other. Also, I can give you some websites to read more about your condition and also about morphine and when we give it to the patients.
Okay, thank you, Doc. That'll be really helpful. Thank you.
Oh, welcome, Mr. Donald. Do you have any concern?
No, thank you. That's all.
Do you smoke or do you drive, Mr. Donald?
No, I've given up driving.
Okay. Do you smoke or drink alcohol?
No, not at all. Straight as an
Oh,
arrow. Yeah.
okay, that's good. Nice to meet you, Mr. Donald, and I hope uh,
Okay, perfect. Time is up. Perfect, Dr. Marwa. Let's hear the comment from Dr. Isos, then I will comment. You can start, Dr. Isos, please.
Okay, yes, I think that went very well. I think she touched everything. The last part about dying, fear of dying, which was going to be after the consent. So I like the fact that she kept asking for the consent. I took this from Ryder. So the reason why I kept talking about the addiction, about the fear of being an addict, because according to this, you're meant to explain that psychological dependence, such as addiction, does not occur when used for terminal pain. And so a fear of addiction is unwarranted. So that may have reassured me better. But I think talking about adjusting the dose was also a good one. So yeah, thank you. I don't think there's anything extra. You asked me about you confirmed my name. I really like the fact that you talked about the social groups, especially with the fact that this gentleman has no family and he lives alone. So having the social, telling him about having social groups where people can, like him, can meet, I think that was very good. Thank you.
thank you, Doctor.
Yeah, thank you, Dr. Marwa, Dr. Isos. A nice scenario, and the concern also there is really amazing. About the addiction, the point of addiction, and the answer from Dr. Marwa was also perfect. Yeah, we are giving you the doses that will not let you dependent and being addict to this medication. We are taking care of this. Most of patients in such condition, they are responding to the or responsive to this medication, which is morphine, and the morphine is the best interest of cancer, and it's the best medication ever to control the pain in cancer patient. So as an answer, yes, it's not necessary to be addict, or it's the dose is dependent. the addiction will be dependent on higher dose. But in your condition, we are giving the minimal dose that could give you the pain control rather than being dependent on the or addict to this medication or as the drug. This is regarding the first concern, the addiction. The second concern, yeah, I'm afraid to die while sleeping. I think Dr. Marwa didn't understand this concern, or
Yes,
yeah,
yes, little understand.
yeah. She repeated this question. Take care. Whenever the surrogate repeat the concern, if you didn't understand it for the first time, even while she's repeating it, you can stop her and answer it because it might be a mark for this concern. So you have to get this mark, even if you missed the first time. Okay, so I will ask you now. I'm afraid to die while sleeping because of this medication. So how you can answer it, Dr. Marwa?
We will give you the minimal dose that keep you pain free, and we will regularly follow up you.
Yeah, so this the same concept. We are giving this dose at a level will not cause you go deep sleep. Yeah, most of this medication, if extra dose given or taking it in extra or higher dosage, it might lead to a coma. In your condition, we are taking care of this point in order not to let you go in deep coma. So
Can we offer anything to do when he is alone and feeling drowsy because he's living alone?
uh,
What he do if he is feel drowsy?
I think this patient shouldn't be alone at home. I
Mm,
think so. He might be in hospice, right? He's terminal cancer. This is what I think. I don't know, Doctor. Is this,
Yeah.
is there yeah, is there any concern or any answer related to this point?
Okay, so from the plan, he lives alone. There is no concern about that. But if you are concerned, like you said, even when he's drowsy, I think just assuring him that whatever we're giving him is not going to tip him into an overdose and um, a deep coma. That's one. Secondly, in this case, I would have probably asked if he has someone who comes to check up on him. So even when he said, I have no family members, I think maybe asking, can we get the social worker involved? Someone who can just come and keep checking on him.
Yeah,
Because even if you say put the vital line, that's the alarm that they press. If he is unconscious, he'll be able to do that. So I think offering can someone check on you may also have helped with.
yeah.
Yeah.
So any neighbor or someone near to you, any family member can stay with you. It's one option, or social support, or I think also the hospice, one of the options he might live with.
Yeah. So I think also the Macmillan nurses, because I think he's with the Macmillan nurses. So I think they do have this outreach where they can just go and see how he's doing. So I think yeah, all that's
Yeah,
Can can we
yeah.
offer nursing home or
Yeah,
yes?
it's the same idea of Macmillan nurse, but Macmillan nurse, I don't know, she is or they are following the patient at home or home nurse.
mm,
Anyway, it's beyond I think the basis level at this point. But keep in mind, as Dr. Iso said, you can offer someone to be accompanying the patient or to be living near to the patient to have a look every now and then if he is fine or not. Apart from that, the medication will be given in a proper dosage will not lead to the coma. It's not overdose and it's not higher dose that lead to coma. Okay, this is regarding the dying while sleep. The other concern was drowsiness. Yes, uh, and I think Dr. Marwa also answered it. We are taking care of the dosage in order not to have this drowsiness. However, maybe also the frequency of the doses better to be given according to the best interest. For example, if the patient during the daytime he will not receive the dose in order not to be drowsy, and instead he might be, or it might be at the bedtime, in order to have good sleep without feeling drowsy at the daytime. The next point, I think it was about, yeah, now the time for the question of advance directive, which is proper on time. You have to ask in this situation why this terminal case, and he has advanced cancer. You don't know for how long he might live. So the way how to answer, to address and to ask this question: do you have any wishes related to your medical condition you want to be done for you? And the answer from Dr. Yusuf, or maybe another surrogate, who will tell you, no, I didn't think so. I will think about it and I will update you about. The other question about lasting power of attorney: did you nominate anyone to take a decision in case you lost your awareness? He will tell you, no, I didn't think, or I will think, or as in this condition, I am alone or living alone. The smoking and alcohol in this situation, I don't recommend it. Why? Because this patient is terminal. They might comment that you ask him to stop while he's dying or he's about to die. So it's not recommended to ask about smoking or alcohol in terminal cases or in advanced cases of cancer, even if the cancer related to the smoke. Is it clear, Dr. Marwa?
Yes.
Yeah, what do you think, Dr. Isis? You didn't comment on this.
Yeah, okay. I'm getting it from your point. Yeah, that's
Yeah,
okay. Yeah.
yeah. Plus,
I didn't think much about her asking the question though, but I get it from your point and although I don't know though, because I think I may still ask, but I won't tell her to stop. Mm, I'm not sure if what others think, because I don't know if I know examiners are different. Will
yeah,
they
you're right.
advise me for not asking? That's my question.
Yeah, so let me tell you, as in fact, we have one, sir, one candidate, one doctor, our colleague. She had cancer pancreas, which was advanced, and the examiner commented that she asked about smoking and alcohol while the patient is already terminal. They commented as negative feedback and they deduct a lot of marks. And they specify a comment about, she is asking about smoking while the patient is having advanced cancer. So based on that, we always advise not to ask about smoking or alcohol in dying patient, or patient is having advanced cancer or advanced disease. Let him enjoy his last days in his life. Whatever he will or it will harm, he already have the end of life, or his condition is terminal, it might end his life. So let them enjoy the last minutes or last hours or last days of his life. Did you get the point, Dr. Isos?
Okay, yeah.
Yeah, so avoid this question.
Okay.
The next, yeah, the driving is important in this scenario. I like when Dr. Marwa asked about this. Why? Because this patient is feeling drowsy, and she said, no, I stopped already, or I quit driving before. But it's important to ask why, because this patient is taking some medication might affect his conscious level. He might have drowsiness while sleeping, while driving. So it's better to ask if he's driving rather than asking about smoking and alcohol. The point of social support was perfect, especially his living alone. So you can offer that he might join this social or committee, that patient is sharing same disease, same idea of cancer, and he might get a lot of support with them. They can share the experience together, and they might have friends from these groups. This is the comment. I think also this is the scenario. Anyone has comment or suggestion he can add? Perfect, Dr. Marwa. I think compared to before, Dr. Marwa, as a communication, you are too much improving, dramatically improving. You have an answer for each concern, and
Yeah.
you know how to do the communication as a skill. Just show more sympathy and empathy. You are showing them, but I prefer to be more act.
Yes,
Okay,
okay.
perfect, Dr. Marwa. Okay, any question, Dr. Marwa, Dr. Esos?
No, I have no question.
Okay, thank you. Any other question from others? Any suggestion?
Uh, can I ask a question,
Yeah,
doctor?
sure, Dr. Yeah, Dr. Iman.
Um, when do I offer the lasting power of attorney or maybe the advanced directory, even only in the terminal cases?
No, not only the terminal cases. Terminal case is one of the indication. If you have patients with progressive disease, you know this patient is his disease is progressing and it worse day after day, like motor neuron disease, for example, or other disease like stroke or a massive stroke, I mean, or other condition that it might be progressive in the future as any cancer. So advanced cancer or poor prognostic cancer, progressive diseases with known case of progression of the disease like motor neuron disease, multiple sclerosis with, for example, the advanced type. All this disease you can ask about. Parkinson, dementia, patient expected not to be awake or conscious in the coming days. All this condition you can ask about advanced directive and lasting power of attorney. Clear?
Okay, doctor. Yes, okay.
Yeah, okay, thank you.
There is also another question. If,
Yeah,
for
sure.
example, the patient is afraid of taking morphine, if there is in any situation another alternative drug, even if he didn't mention it is in the scenario, can I
No,
offer the alternative drug or no?
no, absolutely no. Don't offer something not written in the scenario. The
Okay,
scenario is about morphine, so you have to convince about morphine. He doesn't want to take the morphine. Address why this is what Dr. Marwa did from the first question. Can I know your what you have, what you know about your disease? And the first question, why you don't want to take morphine? Why? Because the all concerns should be answered from this point. Why I should take the morphine and why he's not taking the morphine. Every question from him I should address and I should give him a solution. She gave her three concerns related to the refusal of taking morphine, but never ever give her another option. If you give another option or you suggest something not written in the scenario, you will lose the scenario. Definitely. So your scenario here, the task is to convince about the best interest medication, which was the morphine. Even the patient is suggesting another, no, this is the best interest for you, and we are here to address any concern related to this medication and to give you a solution, but not to give him an alternative. Clear?
okay, thank you.
Yeah, most welcome. Sometimes, sometimes in another scenario we practiced before, they talk about morphine as, for example, subcutaneous. But it's a different scenario. The patient is in severe pain, he lost his conscious level, and now the time to give morphine as subcutaneous. But in this scenario, no, the patient is refusing to take the morphine at all. Since 1 week, he didn't take the morphine. Why? Because he's afraid of. And he give you three reasons: drowsiness, dying while asleep, addiction. So every point should be addressed and give him the not the alternative, the solution or the explanation, just the justification why he should take the morphine, and it's not related to this worry. Reassure him, and at the end you can ask question, what do you think now about morphine? I prefer to ask this question, Dr. Marwa, by the way, at the end, because he was afraid of medication. So at the end, after convincing all these points, you can ask him, what do you think now about morphine? Is it good medication? Okay, and whenever she give you a concern, try to say, I appreciate your worry. Your worry is understandable. I appreciate your point is valid. Your like this, appreciate your concern. Not to give an answer quickly. Okay, try to just appreciate the point who's sharing with you. Okay, I think any other question before ending the session? Any suggestion, Dr. Aisha? Any comment? Okay,
Just
we
as
have
I write
yeah,
the side effect, most common side
yeah,
effect
we
of
Google it.
morphine, the constipation. So
Yes,
usually we advise the patient about drinking water and
perfect,
taking like high fiber diet, and we prescribe also with him or usually laxative.
perfect. Yes, I think I missed this point. Thank you for reminding. This was the fourth concern. I am worried about constipation or to be constipated, doctor. As Dr. Aisha said, and Dr. Marwa as well, she said, you can, we can deal with this. Either saying this in diplomatic way, so we can manage this. No worry about that. We can deal with that. Or you can give him the option immediately. We can advise you to drink plenty of water. The water always help you not to be constipated. We can give you medication that help you to pass and not to be feeling constipated. Okay, and the option is laxative, as Dr. Raisha mentioned. Always with opioid, we are giving patient laxative. It's not only this patient. Every patient on opioid, we are prescribing laxative for him. Thank you, Dr. Aisha. Again, oh, I have a lot of comments in this scenario. Okay, starting by Dr. Sarah. What about mentioning pain management team to adjust the dose and the suitable medication for the pain other than the morphine? Again, don't prescribe or give him another solution. The topic about morphine, so we will give you morphine. To adjust the dose, to change the timing, to change maybe the route, but still the morphine will be given. Okay, this is the task. It was about morphine, and the patient is not taking his morphine. Morphine was prescribed in the best interests. By the way, he is also in Voltaren. But the idea or the concept in this scenario, he's afraid to take the morphine. Okay, his friends, I don't understand what the meaning of friends. Maybe as a social support, you mean? Yes, yes, friends to accompany or to visit him from time to time. Yes, I agree to this point. Dr. Sarah, again, what about alternative in the scenario? Because nothing mentioned to convince the patient to take morphine only. No, it was 1 week patient didn't receive. He refused to take the morphine. So I have to convince him about the morphine. Again, no alternative. Don't give another option not written in the scenario. Don't overthink. Okay. If you overthink, you might be faulty or giving a mistake
But just if asked
medication.
if there is alternative doctor, she can mention yes,
But
but this is the best for you, and this is what decided by consultant.
yeah, if he insists, you mean, and he asks,
Ask if there is alternative. You should be honest. Yes, but this is the best for your condition.
yeah, I'm talking about suggestion, Dr. Aisha. You will
No,
not
not to
suggest.
suggest. Yes.
Yeah, don't suggest. If he insists to have another option or alternative, this medication was prescribed to you in the best interest of your condition. That's it.
Yes,
He
if
can,
she insists, this means that she refused. So you will arrange another meeting with
yeah,
consultant. Or
exactly.
yes.
Yeah, exactly. And you can, if he insisting, refusing till the end, now the time for DAMA refusal form and address again the concern. If not, still he's refusing, arrange a meeting as Dr. Aisha said. I think this is not the scenario. The scenario is about just refusing and he want to be sure that everything will be fine. But other scenarios, as Dr. Aisha said, he might be resistant till the end. No, doctor, I'm not convinced. I don't want to take this medication. Please let me die, for example. I don't want to be alive. Whatever the concern, address it, and at the end, arrange a meeting with his consultant. Okay, Dr. Muhammad Omar. I agree, Dr. Basim. Don't ask about alcohol and smoking in terminal patient. Perfect. Thank you, Dr. Muhammad. I hope all understand this idea because it's like fatal mistake. Believe me, if you do so, you might have deduction in a lot of marks. Dr. Kinana. A long time, Dr. Kinana, you didn't join. Palliative care or end of life care, we must talk about or not. Actually, no time to talk about them. Although you might talk, but it's not the task here. And I think the concerns about the morphine will not give you time to talk about end of life or palliative. Maybe this patient already explained about this in another meeting. That's why he's on morphine. And by the way, morphine is one of the palliative therapy as a painkiller. So it's not necessary here to talk about it. It's supposed to be explained already to the patient, and this medication was one of the palliative steps. Now we are talking about ingestion or administration of morphine, not about explaining the management plan. Always offer help for those people with Dr. Sarah again with terminal illness rather than stopping alcohol smoking. Again, agree 100%, absolutely right. Dr. Sarah, last, it is better to die during sleeping. Oh my God. You know, it was in my mind to mention that. Yeah, those people were suffering from pain, and I think at the end of their life, they will be in coma because either because of the disease, progression of the disease, for example, metastasis to the brain, or he should be given high dose of morphine to induce more peace for him to die in peace, as we assume. So it's equal to die while sleeping, but not as a direct answer to his worry. He's worried to die asleep, so you will tell him, no, you have to die and sleep. It's funny point, but don't do it in the exam. Okay, thank you everyone. It was very nice interactive message, particularly the last message. It's so funny. Anyone has comment, suggestion, concern, or we can say good night. Okay. Before ending the session tomorrow, sorry, I have flight, so I cannot run the session tomorrow. But I say again, as I promise, if two partners they can arrange together, or they can have a partner to arrange, for example, Dr. Marwa and Dr. Isos, they can arrange together to be partner in a session. Send me, then I will run the session. I will run one session for each station, for example, at least once a week during my vacation, I mean. So one long, one communication, and if I can, I will do one more short, which is the short station or clinical station. It would be enough for me and for the group just to keep the continuity of the practice. Otherwise, it will not be in a daily basis. Please, if you are interested, if you have partner already arranged, please message me. Then I will run the session for you. Okay? Understand for all. Any concern before ending the session? So I can say that tomorrow is off again because of the flight. Maybe at the week before the weekend, for example, Wednesday and Thursday, I will try to run a session. Anyone interested to message me privately, and hopefully we will not stop this session. I will try my best not to stop this session, even as I said, once weekly for each station. Thank you everyone for the join. Thank you everyone. Thank you, Dr. Salma, Dr. Marwa, Dr. Isos, and Dr. Kinana. Well done, Dr. Isos, as first practice. I'm so sorry to be joining now, and I'm not convinced to do the session with while you just joined, but it's okay. Again, inshallah, hopefully I will not stop this session even in the vacation. See you inshallah soon. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.